Thank you, Miriam, and thank you for the opportunity to present at the conference. My name is Sonia Saluja. I'm in the role of Head of Course for Medical Science here at CQUniversity, and today I'm co-presenting with my colleague, Helen Keen-Dyer, Academic Lead Learning and Teaching in the School of Health, Medical and Applied Sciences. Welcome to our presentation. Okay, I'll just go through a sequence of events in terms of what happened and then what did we do. So under the theme virus crisis, for many teams, COVID-19 presented challenges and disrupted many of the historically mediated ways of working. And as teaching transitioned online, it also triggered the need to develop alternate assessments to replace the on-campus invigilated exams. In the medical science team, it necessitated the development of online assessments for anatomy, physiology, pathophysiology. These units and these subjects are offered to students of multiple health professional courses. Now, during this challenging time, the burden of developing the online assessment and to develop an appropriate online assessment, that fell to the individual academic. And in what we termed as the emergency response phase, there were considerable challenges to sustain a focus on the quality and the good practice in development of online assessments. So to overcome these challenges, as head of course of the team, I introduced a collaborative approach amongst the team, which incorporated a peer review quality enhancement process. And that was based on a staff buddy system. Now, naturally, lots of questions arise about this in terms of the who, what, where, when, why. So I'll start with the why. Why was this initiative taken? For the invigilated on-campus exams, traditionally there is a review process, an academic and administrative review process available, which is used within the university through AIMS, our Academic Information Management System. Now that no longer existed, but we really wanted to ensure that we were delivering a quality product to our students. And thus, that is the why of this initiative was taken to initiate the peer review quality enhancement process. So what was the process? There were two parts to the process. One was the development of the online assessment by the unit coordinators. And the second part was the peer review by the team members and head of course. When did this occur? We held weekly team meetings on the onset when teaching transitioned online. We had weekly team meetings and we developed a structural framework to decide on timelines for the review of the assessment, for the development of the assessment. Where did this occur? This occurred completely online. So rather than reviewing an assessment in a Word document or a PDF, we decided to review the assessment on Moodle, which is the learning management system that we use, to review it on that platform as a student-facing experience. So the reviewer reviewed that online assessment on Moodle, and with each click, a new question would pop up, similar to what the student would face. The who was involved, the team members were definitely involved in this, but most importantly, also a who, even though they're not directly involved in the process of peer review, was the student. The whole reason we were doing this was to ensure that we are developing and delivering quality assessments for the students. How did this proceed? The review happened, definitely. It happened online. The review happened through Moodle. And then the unit coordinators, the reviewers provided the feedback through email. So all reviewers could view the feedback. The unit coordinator then responded to that feedback. And then once again, reviewers had the opportunity to review the assessment after feedback was incorporated before it was then made available to the students. Within this rapidly changing time, we wanted to ensure the quality and So that structural framework, how did that happen? Within our weekly team meetings, we decided on a set of agreed timelines. So within the 12-week term that we have here at CQUniversity, we decided that by week 9, unit coordinators essentially agreed that that was the timeline by which the assessments, online assessments, would be developed and available for review. And then from there, the timeline proceeded in terms of review of the assessment and then responses to the review to make sure that it was available by the end of term. What were the focus areas? It was very important for us that when we are reviewing it, we identified what are some of the focus areas which were essential to quality assessment. So for example, some of these focus areas were alignment to learning outcomes. We wanted to make sure that the online assessment that was being developed, was it aligned to the learning outcomes? Was it pitched at the right year level? Was it appropriate for year 1 or year 2? Academic integrity was another key issue for us. So we looked into subsets in terms of what were the number of questions, for example, total number of questions being provided to the students. What was the time duration? What were the types of questions we were offering to the students? Were they mainly recall type of questions? Was there any application of theory type of questions? What elements of question design could we incorporate so that there was more application of theory, something that students couldn't easily search up for an answer. We looked into the distractors that were being offered to the students. So these were all elements of academic integrity. We looked at student experience as another focus area. When the students were viewing the assessment on Moodle, what did it look like for them? Consideration was given to points such as contrastive images, labeling, cognitive overload. So student experience was important for us. We also looked at the clarity of the question and answers to make sure there wasn't any ambiguity. And so all these focus areas were very important, and even though we were looking at subsets within it, it all went back to a focus area and the student experience. The buddy system definitely facilitated this process of peer review. Earlier in the year at a team retreat, we discussed a buddy system in which within the team, staff members nominated themselves as a buddy for another unit. And the buddy would provide support to the team member in different roles depending upon the need and requirement. For example, it could be in tutorial delivery, it could be to provide marking support, it could be for review of a document. And so that concept of a buddy system, that helped us greatly when we proceeded for this peer review. At the end of term, we collated feedback amongst ourselves from the perspective of what worked and what didn't work. And I'll hand it over to Helen now. Before I do want to give my sincere thanks to the team for wholeheartedly participating in this process. And hand it over to you now, Helen. Thank you.
Thanks, Sonia. Good morning, everyone. I'm Helen Keen-Dyer, and I'm the Academic Lead for Learning and Teaching in the School of Health, Medical and Applied Sciences. So as Sonia said, COVID-19 presented an unprecedented challenge and disrupted many of the ways that were traditionally working within the environment. It really necessitated fundamental changes to the assessment practices for this area, and it was done so on the fly and obviously in a time-pressured and rapidly changing environment. In the words of the medical sciences team, it was a steep learning curve, and we, as in the staff, didn't have time to prepare either. And as it turned out, administering the alternative assessments took a greater time than the invigilated exams. But despite the extra workload, mitigating the risks to staff and students was seen as key. And in the absence of a university-wide approach, the medical sciences team created their own quality assurance review process for the online alternative assessments. As the academic lead, I have the privilege of watching on and talking to these team members, and I'm really pleased to share with you some of their lessons learned and their reflections. So looking back, what were some of the key lessons learned? Uniting around a shared imperative. The challenge of replacing face-to-face invigilated exams with quality online assessment experience united the team. It was about keeping the integrity of the assessments when done online, but also being able to appropriately assess the knowledge and skills of our students. It was about taking the content of scheduled invigilated examinations and putting it into the online interface was not enough. It involved creative solutions such as bringing the labs to students, of recrafting and recasting assessment tasks, and of creating wholly new strategies specifically aimed at supporting our students. Time may have been in short supply, with staff and students scrambling to keep their heads above water, but preparation was the name of the game. Mock assessments, guides to support student understandings, and activities to orientate students to these new assessment instruments were swiftly created and implemented. And that, as the poem goes, made all the difference. Teamwork was key, as Sonia said. The medical sciences way, as I come to refer to it, involved teamwork all the way. Without teamwork and the active participation of each team member, the process and the outcomes would not have been realised. Teamwork was also key in the harder lessons learnt, those cases where the experience was different to what was anticipated, and that could be expected in such a context, where the alternative assessments didn't run as smoothly as others and where solutions served as a learning experience. These experiences were a catalyst and continue to serve as enhancements. Sonia, would you mind moving that slide on for me? Thank you. So looking forward, what impact has this quality assurance review process had? Well, a lot. In short, for example, students experience an enhanced range of assessment approaches. As we can see by that first extract, for Dr. Deborah Carlson, the quality review process has enabled her to explore assessment tools she would possibly not have considered. By looking at what other academics have used and what I've used, I've been able to change some of my assessments and improve the student experience in relation to their assessments, which is just fantastic. Similarly, Rosalind, another team member, reflected that reviewing on other assessment tasks that were different to what she used gave her ideas on how to improve the way in which she asks questions. Here, the review process has served as a catalyst for reflective practice and a learning loop. Resources and resource banks also came out of this initiative. As a direct result of the alternative assessment process, there are now resources such as an image bank containing high-resolution photograph artefacts, and question banks, which are now available to all team members. As one of the team members said, it was extra work up front, but efficiencies in the future. Time and effort are already reaping benefits. Risk and risk mitigation also became important. The review process has resulted in a greater appreciation of the risks and pitfalls in the online assessment methods and in developing strategies to mitigate these risks. For an example, an appreciation of the impact of changing from one assessment approach, the invigilated exam, to the online quiz. And in the words of one of the team members, a risk I discovered with my group of students was a lack of understanding about what an online assessment would be like to do. So preparation, or more importantly, a lack thereof, is a risk. Preparation for the new way, the next normal, is central, and supporting students in the what to expect in the online assessment world is now standard operating procedure for this team. The learning curve was steep, however. After all, not only was the task at hand high stakes, developing online assessments in the middle of a pandemic, but it has reaped rewards. And as one team member has said, this term we are much more prepared and have a better idea of what's going on, how to set up online assessments, questions to ask to minimise the work and stress for staff, and the experience for students. And what about our staff? Well, as you can see from the extract from Candice, it was not an easy task. Having this review process in place allowed us to work together as a team and to figure out how to tackle these assessment items. And from Rosalind, I liked that it provided an opportunity to have open discussions around assessment tasks and to question assessment tasks with colleagues. And finally, as Charmaine so eloquently put it, it's given me greater confidence in the quality of assessments that are used in my units. Many times we may second guess what is done, but with a review process, it alleviates the stress, and what a fantastic outcome. Undoubtedly, the past has been food for thought for the future. A future where there are new understandings of assessment practices and assessment quality assurance, new understandings about the approaches to student preparedness, and a supportive and supported team who are now better prepared to deal with future disruptive events. And in the spirit of that team, Sonia, if you wouldn't mind moving that slide on, it's a great privilege for me to be able to share this presentation with Sonia, but these are the people along with Sonia who really made this happen. So thank you, Miriam. We're at our end of our presentation.
Well done, thank you. I was just writing some notes while you were speaking, and the two things that impressed me was that you kept saying it was on the fly, but it doesn't sound like it suffered the normal, casualties of being on the fly. It sounded organised, it sounded collaborative, it sounded like it actually produced quality and in a supportive manner. It doesn't sound like your colleagues were left floundering. And what impresses me most is you're both heads of your areas. So this is coming from the top, and obviously you've been considerate all the way down. So thank you so much for sharing. If you've got questions for Sonia or for Helen, please put that in the chat. We've got a couple there. So if you could respond to them. In fact, we've actually got a couple of moments. So one of the questions is, how did you manage the students' teamwork in between? Not sure what that one's asking. So if you'd like to ask that again, Romana. She might be typing in there. Yeah, because you all had teaching going on, didn't you, while this was happening? So it wasn't a put down the tools and keep going. All right, there's a couple of chats coming through, so if you could respond to them, that'd be great.
Yeah, sure. Happy to answer that one. For the student doing their online assessment, they had to log in via Moodle and complete their assessment that way. And also to address the fact of the students' teamwork in between. I'm looking for a bit more clarity on that question, but I can provide a response for the online quizzes that were developed. Each online quiz had multiple sections to it, and the questions for each section were drawn from a pool of questions. So we had a bit of randomization of questions going there to ensure that even if there were two students who may have been in the same area, they had different questions pop up as question number 1 and question number 1 for each one of those students.
Thank you very much for that, Sonia.